Americans are being vaccinated to fend off the coronavirus in record numbers, but there are still millions who are resisting rolling up their sleeves. Dr. Christina Bryant of the University of Evansville joins us this morning to promote a new public service campaign to get folks on board. Good morning, Dr. Bryant.
Good morning.
In your research and in the work you're doing, why are people saying they're reluctant or resistant to accept any of the vaccines?
Well, so we know that up to 40% of American adults have questions about COVID-19 vaccines, and perhaps some of them are uncertain about whether or not they should be immunized. And so the Ad Council and the COVID Collaborative have recognized that people really need more information. So they've put together a campaign to get people the information they need to make a good choice for themselves and their family. So what people need to know about COVID-19 vaccine is that these vaccines that are available to us are safe and effective. They will protect most people from getting sick from COVID-19, or they'll protect from developing serious illness, and they're going to help us to get back to doing all of the things that we love to do. Gathering with family and friends, going to sporting events. So it's a step toward normal.
Well, let's talk about the public service announcement. Has it already rolled out?
Yes, there is really a terrific website called getvaccineanswers.org that answers a lot of the common questions that people have.
And what are some of the leading questions folks have?
Well, so people want to know, is it safe? Yes. So people may say, well, I had a friend who was vaccinated and they had a fever, or they were fatigued afterwards, or they had a sore arm. And actually, these are all really expected, and they're not bad news, because those sorts of symptoms after vaccination really are just a sign that the immune system is working and responding to the vaccine. People say, do I really need it? Am I at risk? And I will say, yes, there is still COVID-19 circulating in our communities. In many states, cases are on the rise. People are at risk, and getting a vaccine is a step that people can take proactively to protect themselves and to protect others in their family who are not yet eligible for vaccination. For example, young children. A common question or statement that I hear is, hey, I don't want to be first in line for these newer vaccines. And what I say to people is that, hey, if you're signing up to get a vaccine today or tomorrow, you are far from first in line. Millions of people in the U.S. have been vaccinated.
And it's going really well. It's moving faster. So if we can, how can we access the PSA, and how can we learn more?
To learn more, go to getvaccineanswers.org.
All right. Thank you so much, Dr. Bryant, for being with us.
Thank you for having me.
More local lifestyles right after this. Stay with us.